Hello students, welcome to Karnataka DC LMS e-learning platform. In today's session, let us learn about endoscopy. Endoscopy. In this particular image, you can see how an endoscopy is being performed. An endoscope is made to enter into the stomach via the mouth, and in the stomach region that end carries a camera which gives us the visualization of what is inside, and it is illuminated by a light source from outside. Via total internal reflection we can see the interior of the organ. So this is what is known as endoscopy. Now let us learn about endoscopy in detail. Introduction. Meaning of endoscopy means to look inside. Endoscopy is the insertion of a long, thin tube directly into the body to observe an internal organ or a tissue in detail. It can also be used to carry out other tasks including imaging and also minor surgeries. Endoscopes are minimally invasive and can be inserted into the openings of the body such as mouth, anus, etc. Alternatively, they can be inserted into small incisions, for example the knee or abdomen. That is, if there is a natural opening, say for example ear, nose, mouth, anus. So these are the natural openings. So the tube can be inserted via this. I do not mean that via the ear you can enter the stomach, but you can observe the ear region using this opening. Even the nasal region, via the nasal openings, the nasal region can be observed. Via the mouth, the entire gastrointestinal as well as the respiratory structures can be analyzed. Similarly, via natural openings, most organs can be accessed. But if there is no natural opening, then via a small cut or an incision, the other organs can be observed. Say for example, in case of knee, there is no natural opening. So through a small cut or an incision, the endoscopy can be performed. So it can be done via incisions also. Now, surgery completed through a small incision and assisted with special instruments such as endoscope is called as keyhole surgery. Anyways, the endoscopy is going inside. Along with it, if it has been assisted with some special instruments, even a minor surgery at a very minor level can be done. So this is known as keyhole surgery. So it combines the principle of surgery as well as endoscope. Now, because modern endoscopy has relatively few risks and it gives detailed image and it is very quick to carry out, it is proven useful, incredibly useful in most areas of medicine. Endoscopes are very quick and they are relatively safe. The first endoscope was designed in 1806. Here is the image of how a typical endoscope looks like. Moving on to the principle. Endoscope, minimally invasive diagnostic medical procedure which is used to evaluate interior surface of an organ. It refers to the procedure of looking inside the body with an endoscope for medical reasons. It is an instrument used to examine the interior of a hollow organ or cavity of the body. Why hollow? If it is not hollow, then the endoscope can't enter. Mostly, the term endoscopy refers to an examination of the upper part of the gastrointestinal tract, but this image is no longer existing because it is not only applicable to the gastrointestinal tract, but it is also applied to other regions of the body. Unlike other medical imaging techniques, endoscopes are directly inserted into the organ. The principle of total internal reflection is used in the endoscope by using optical fibers. Here in this image you can very clearly see that this cable is the endoscopy cable. There are two ends for it. One is the receiving end, other one is the illuminating end. From the illuminating end the light enters. You can follow the arrows. So the light is entering, it is entering until the object, and then it is being reflected back or it has been illuminating and it is hitting back and again entering via the inner optical fibers, and it is reaching the receiving end. So by the time it reaches the receiving end, it is not just seen, but it is also magnified. It is illuminated and magnified at the same time. So here we have the light source, here we have the receiving end, or where it has been visualized. It could be done using naked eye, or it can be even connected to a video monitor and observed via a video monitor. And it has optical fibers, inner and outer fibers. There is a telescopic system where the lenses are placed so that we get the magnified image of the target organ. So this is the principle behind endoscopy. Now the endoscope is a flexible tube which is equipped with lenses and a light source. It has the ability to look inside the body using a variety of very small cameras attached to the tube, because the tube can be rigid as well as flexible. So it is mostly flexible, but sometimes the tubes which are used are rigid. It facilitates direct viewing of the interior of an organ and is often very helpful in determining the cause of the problem. One of the two main cables of the endoscope carry light from a bright lamp into the body. This illuminates the cavity where the endoscope has been inserted, and now the light bounces along the walls of the cable into the patient's body cavity. Now, video endoscopy is performed by attaching a microchip camera at the insertion tube. Setup image is viewed on a video monitor. Now, moving on to the applications. The main reason of endoscopy is to investigate, confirm and treat a disease or the problem. Endoscopy can be used to remove tumor or polyps from the digestive tract. Endoscopy has advanced in recent years, thereby it has enabled surgery also, which can be conducted with the help of endoscope by modifying the endoscope. So this makes the surgery less invasive, and procedures like removing gallbladder, tying the fallopian tubes, removing small tubers from digestive system and lungs are now very common. So it is performed with the help of an endoscope. Endoscopy may also be used to investigate symptoms in the digestive system like nausea, vomiting, abdominal pain, difficulty in swallowing, gastrointestinal bleeding. So all this can be checked using an endoscopy or endoscope. It is also used in diagnosis, most commonly by performing a biopsy to check the conditions like anemia, bleeding, inflammation, cancer of digestive system, etc. Now, the procedure may also be used for treatment like cauterization, like cauterizing a blood vessel, widening a narrow esophagus, clipping of a polyp, or removing any foreign objects from the body. Now, endoscopy can be useful in wide array of medical situations. Endoscopy is useful for investigating many systems with the human body. So these areas are gastrointestinal tract, for example, esophagus, stomach and duodenum. The endoscopy is called as esophagogastroduodenoscopy. For small intestine, it is known as enteroscopy. For large intestine, it is called as colonoscopy. Anus, it is called as anoscopy, and the list goes on. It is not just used in gastrointestinal tract, but it is also used in respiratory tract. It is most commonly known as rhinoscopy for nose and bronchoscopy for the lower respiratory tract. It can be also used to visualize the ear region, so it is known as otoscopy. For urinary tract, it is called as cystoscopy. For female reproductive tract, it is in general called as gynoscopy. If it is done in particular for the cervix region, it is called as colposcopy. For the uterus, it is called as hysteroscopy, and for fallopian tube, it is called as falloposcopy. So these are done using the natural openings in the body. But if it is done through small incision, say for example in abdomen or the pelvic cavity, it is called as laparoscopy. In the joint region, it is known as arthroscopy, and in chest, it is called as thoracoscopy. Here in this image, you can see the list of such endoscopies of different regions. Now, the next application is a laparoscope. It is a modified endoscope which is also used for keyhole surgery. Say for example, in the gut region, I found that there was a cyst or some tumor-like appearance which was blocking the passage. Now anyways, the endoscope is inserted. If this endoscope is modified such that that cyst or polyp or any obstacle can be removed, then it is known as a laparoscope. So it is basically used for keyhole surgery. Say for example, we'll take appendix. We know it's a useless organ in the body, but if it is facing an infection, then it is called as appendicitis. Then it has to be removed. Instead of going with a surgery, a keyhole surgery can be done. That is, the endoscopy can be inserted into that region and the appendix can be removed. So this is known as appendectomy. Similarly, uterus can be removed, which is known as hysterectomy, and prostate tissue can be removed, known as prostatectomy. So the advantage of this technique is that very less blood is lost during the surgery and after the surgery, and the recovery rate is also fast when compared to a conventional surgery. And now endoscopy is also used for many procedures. Say for example, during pregnancy, the amnioscopy and the fetoscopy is done using endoscopy itself. It can be used to perform various plastic surgeries. It can be used in panendoscopy, also known as triple endoscopy, because it combines laryngoscopy, esophagoscopy and the bronchoscopy. It can be done for, it can be used to perform orthopedic surgeries like hand surgery, knee surgery, ligament construction, bursa, which is also known as bursectomy. It can be used to perform endodontic surgery, endonasal surgery, endospinal surgery, and many more surgeries. This slide summarizes the application of endoscopy. It also speaks about the future of endoscopy, maybe down the line in another 10-20 years. So endoscopy can be used to remove mucosal lesions. It can be used for the direct drug delivery. It can be used to take biopsy of the nerve and muscle cells, muscle tissue. It can be used for removing intramural lesions. It can be also used to harvest tissue, especially if you are looking for stem cells. And it can be used to place and stimulate monitoring devices inside the body. Also, it can be used to shape the anatomy. This is some sort of a plastic surgery itself. So if you are doing it for muscles, then it is known as myotomy. So this is the application part of endoscopy. To quickly summarize, endoscopy is the insertion of a long thin tube directly into the body to observe an internal organ or tissue in detail. The principle of total internal reflection is used in the endoscope by using optical fibers. It facilitates direct viewing of the interior of an organ and is often helpful in determining the cause of a problem. The major application of endoscopy are investigation, confirmation, and treatment. Thank you for watching.